An arteriovenous malformation, AVM, is an abnormal tangle of blood vessels in the brain or spine. Some AVMs have no specific symptoms and little or no risk to one's life or health, while others cause severe and devastating effects when they bleed. Treatment options range from conservative watching to aggressive surgery, depending on the type, symptoms, and location of the AVM. Normally, blood flows from the heart through large arteries to all areas of the body. The arteries branch and get smaller until they become a capillary, which is just a single cell, thick. The capillary bed is where the blood exchanges oxygen and nutrients with the body tissues and picks up waste. The blood travels from the capillary bed back to the heart through veins. In an AVM, arteries connect directly to veins without a capillary bed in between, Fig. 1. This creates a problem called a high-pressure shunt or fistula. Veins are not able to handle the pressure of the blood coming directly from the arteries. The veins stretch and enlarge as they try to accept the extra blood. The weakened blood vessels can rupture and bleed and are also more likely to develop aneurysms. The surrounding normal tissues may be damaged as the AVM steals blood from those areas. There are 4 types of AVMs. The first type is arteriovenous malformation, which is the abnormal tangle of blood vessels where arteries shunt directly into veins with no intervening capillary bed. High pressure. The second type is cavernoma. This is the abnormal cluster of enlarged capillaries with no significant feeding arteries or veins. Low pressure. The third type is venous malformation. Here there are abnormal cluster of enlarged veins resembling the spokes of a wheel with no feeding arteries. Low pressure, rarely bleed, and usually not treated. And lastly, the fourth type called capillary telangiectasia. This is the abnormal capillaries with enlarged areas, similar to cavernoma. Very low pressure. AVMs can form anywhere where there are arteries, veins, and cause symptoms based on their location. Brain AVMs can occur on the surface, also called cortical, deep in the thalamus, basal ganglia, or brainstem, and within the dura, the tough protective covering of the brain. Dural AVMs are more accurately called arteriovenous fistulas, AVF. The veins of the brain drain into venous sinuses, blood-filled areas located in the dura mater, before leaving the skull and traveling to the heart. In an AVF, there is a direct connection between one or more arteries and veins or sinuses. Dural RV fistulas and carotid cavernous fistulas, CCF, are the most common AVFs. Now embarking on the second place affected by the AVM, the spine. Spinal AVMs can occur on the surface, extramedullary, or within the spinal cord, intramedullary, and are classified into 4 types. Type 1, which is the most common, is a dural arteriovenous fistula. They usually have a single arterial feeder and are thought to cause symptoms by venous hypertension. Type 2, also called glomus, is intramedullary and consists of a tightly compacted nidus over a short segment of the spinal cord. Type 3, also called juvenile, is an extensive AVM with abnormal vessels, both intramedullary and extramedullary. Type 4 are intradural extramedullary arteriovenous fistulas on the surface of the cord. Who is affected? AVMs of the brain and spine are congenital, present at birth, and relatively rare. Approximately 300,000 ton, 14%. Americans have AVMs, but only 12% of those experience symptoms. They affect both men and women at about the same rate. They can occur at all ages, but most often cause symptoms between 20 and 40 years. What are the symptoms? The symptoms of AVMs vary depending on their type and location. While migraine-like headaches and seizures are general symptoms, most AVMs do not show symptoms, asymptomatic, until a bleed occurs. Common signs of brain AVMs are sudden, severe back pain, weakness in the legs or arms, paralysis. How is a diagnosis made? Whether you or a loved one was brought to the emergency room with a ruptured AVM or are considering treatment options for an unruptured AVM, the doctors will learn as much about your symptoms, current and previous medical problems, current medications, family history, and perform a physical exam. Diagnostic tests are used to help determine the AVM's location, size, type, and involvement with other structures. The tests include computerized tomography, CT scan, magnetic resonance, angiography, MRA, treatment in-cued radiosurgery. It aims a precisely focused beam of radiation at the abnormal vessels. The procedure takes several hours of preparation and 1 hour to deliver the radiation. The patient goes home the same day. After 6 months to 2 years, the vessels gradually close off and are replaced by scar tissue. The advantage of this treatment is no incision and the procedure is painless. The disadvantages are that it works best with smaller AVMs and may take a long time to show effect, during which time risk of hemorrhage exists. Endovascular therapy is a second way of treating AVM. Endovascular treatment uses small catheters inserted into your blood vessels to deliver glue or other obstructive materials into the AVM so that blood no longer flows through the malformation. Occluding material, either coil or acrylic glue, is passed through the catheter into the AVM. The advantage of this treatment is it's less invasive than surgery and can be used to treat deep or inoperable AVMs. Disadvantages include risk of embolic stroke from the catheter and rebleeding since the AVM is not completely obliterated. Surgery is another way of treatment to be considered. Using general anesthesia, a surgical opening is made in the skull called a craniotomy. The brain is gently retracted so that the AVM may be located. Using a variety of techniques such as laser and electrocautery, the AVM is shrunken and dissected from normal brain tissue. The advantage of surgical treatment is that a cure is immediate if all the AVM is removed. Disadvantages include risk of bleeding, damage to nearby brain tissue, and stroke to other areas of the brain once removed.